Assalammualaikum warahmatullahi wabarakatuh. Ladies and gentlemen, thank you for attending today's event. As we are about to begin in a few minutes or so, let me remind you our housekeeping rules. The link to attendance and feedback form is given in the description below. If you have any questions, please write your questions alongside with your name in the comment section. Please do pay attention throughout the whole session as it contains various interesting information. Thank you for your kind cooperation. A very good morning to our speaker, Dr. Ahmad Zuhdi bin Suradin, and all of the participants. My name is Faqiha, and I will be your moderator for today. Please allow me to introduce to you a little bit about our guest speaker today. Dr. Zuhdi graduated from the Ain Shams University in Cairo with a Bachelor of Medicine and Surgery. He has vast working experience as a housemanship officer and a medical officer in various hospitals and clinics such as our Health and Wellness Clinic in Gombak campus. We are blessed to have Dr. Zuhdi today to deliver a mental health talk on anxiety, depression, and stress, and how big the impact is to us. Before we begin, let us recite Kitab Al-Fatiha.
إياك نعبد وإياك نستعين الصراط المستقيم صراط الذين
Ameen, Ameen, Ya Rabbal Alameen. Recently, everyone is becoming more aware about mental health, and we students, well, some of us do get anxious before our presentation or stress about our upcoming finals, or maybe you are just curious about mental health. Well, here's your chance. Please welcome Dr. Zuhdi.
Okay. Assalamualaikum warahmatullahi ta'ala wabarakatuh. Thank you for it contain a lot of message. Maybe we can see it together.
When I am down and oh my soul so weary, when troubles come and my heart burdened be, then I am still and wait here in the silence until you come and sit a while with me. You raise me up so I can stand on mountains. You raise me up to walk on stormy seas. I am strong when I am on your shoulders. Raise me up to more than I can be. You raise me up so I can stand on mountains. You raise me up to walk on stormy seas. I am strong when I am on your shoulders. You raise me up to more than I can be. You raise me up so I can stand on mountains. You raise me up to walk on stormy seas. I am strong when I am on your shoulders. Raise me up to more than I can be. You raise me up so I can stand on mountains. You raise me up to walk on stormy seas. I am strong when I am on your shoulders. You raise me up to more than I can be. You raise me up to more than I can be.
Okay, right. Okay, how is it? Anybody cry when see this video? Whenever
I
I see this video, is um you feel you like you want to cry inside, isn't it? I watched this video many times. So it's like it's a short video. It's because as said in if you all see the what we call Three Idiots movie, there is the lecturer, the principals told the students, life is a race, right? Life is a race. Yes, life is a race. So um, in that video, we can see the athlete, Derek Raymond. His name is Derek Raymond. He's the favorite to win the Barcelona Olympics race that time. But in the middle of the race, where we can make an analogy like, in the middle of our life, life is not always beautiful. So in the middle of the race, you will have lots of tests, with a lot of stress, maybe depression, emotional disturbance. So you need support, right? When the father comes, it's like your support. You need a good support system. All right. So we go to our talk. Okay, can we start with the first slides, because I have only 1 hour to discuss about this topic. It's a very big topic. Actually, I'm not the best person actually to discuss about this topic: anxiety, depression, stress. How big the impact to ourselves? Actually, I suggest to the moderator, actually, Sister Madiha, to find a psychiatrist. And I think he's the best person. But he said he want our medical doctor in Goba. So I try my best. Because it's not like a teaching class. It's like more like to sharing my experience. Yeah? Because before I used to work in psychiatry department for a few years. All right. Yeah. So I would like to share my a little bit experience about this. Okay, can we move to another slide, please? Next slide, please. All right, content of my talk here, we have a few topics. I will discuss in a short and sweet, inshallah. All right, this is not an academic class. All right, so I have introduction, mental health stigma. Okay, I will share some common cases I see in IIUM Health Center, especially in Gombak. Okay, difference between psychiatric. People always ask you, what is the difference between psychiatric, psychology, and counseling? I will like to elaborate a little bit. Stress versus depression as our topics today, and also I would like about anxiety. Is it a big issue? So I would like to touch about e-learning, because everybody are facing e-learning right now, and does it impact of your mental health, and how to help your friends. All right. And then we have Q&A question, inshallah. If you have any question, and if I know, I'll try my best to answer. Next, please. All right, introduction. Next. All right. If we go through at a glance, mental health facts. 1 in 3 adults experience mental health related issues. And we can see from the data, 75% before age of 25. Is like, you know, if we have 100 mental health patients, 75% already have mental health issues before reach adulthood. 800,000 world population committed suicide. And suicide, that means 1 in 40 seconds. I've been talking about around 10 or 12 minutes already how many suicides occurred around the world. Okay, you can see here in Malaysia also, 280 cases of suicide reported in Malaysia during MCO. Is 1 per day average, which 10 to 20% not reach the psychiatric services. Okay, so mental health actually is a pandemic. It's like COVID lah. It's not like COVID. We are talking about COVID as a pandemic in this world. But also mental health also is a pandemic as well. Next, please. Okay, not all wounds are visible. So not all wounds are visible. Maybe we have physical injury. Okay, we have motorbike accident, for example. We can see the bleeding. But mental health, you can, is something that cannot visible. Sometimes patient render to hide or not to manifest their true feelings inside, just because they don't want to be labeled as mental health patient. So mental health is really matters, and let's us end the stigma. Next, please. Okay, 3 main area of mental health. Okay, we have International Day of Happiness. We celebrate every 12 March. Okay, there is 3 main area we were highlighted by this day, which is emotion, cognitive, and behavior. So emotion is keep calm, cognitive is stay wise, behavior is be kind. All right, so good mental health doesn't mean that you don't have depression, you don't have bipolar disorder, you don't have anxiety, you don't have schizophrenia. Okay, mental health is for example, I give to you, many people don't have any psychiatric problem, don't go follow up under counseling or psychiatry or counseling or psychologists, but they have mental illness in terms of what? That means in terms of very poor anger management, for example, jealousy, what we call hasad, in Arabic they call hasad, which is not kind to other people, so-called selfish, which is they are not under psychiatry or psychology or counseling follow-up, but they don't have a good mental health. All right. Okay, that's the message from these slides. Okay, next. Okay, 6 tips of mental health is, number 1 is sleep. Good sleep is very important. I used when I already work in IIUM Gombak clinic for already I think about 6 years. One of the common causes, what we call presentation of patients or students coming to clinic is sleep problem. Sleep problem. They just complain that I cannot sleep. I might, just sleep for 1 or 2 hours per night. Okay, so this is when you have a good sleep, there will be a very, very tough moments for you, because this one is this one is like battery. You need to rest, you need to charge your brain. Okay, so sleep is very important. Number 2 is relax. All right, so for anxiety patient, it's very difficult to be relaxed. So don't worry, be happy, just relax. You need to be calm, okay. Number 3 is think that your brain is plastic. What does it mean? Because in our brain there is a term we call neuroplasticity. All right, neuroplasticity, it means that your brain actually can generate new brain cell. For example, for this moment, you are facing a stress because of, you know, because of MCO, because of the, you know, e-learning, you know, for this time. But doesn't mean in the future you will have you know, like same stress or same stress management, because this stress management is can be learned. So for this time, actually, maybe your you know, the in terms of your threshold of stress is low, but maybe on the next time, maybe on the next 10 years when you work, okay, when you by experience during your life, actually you can learn how to cope with your stress, things like that. So the brain is plastic, you know, there is a neuroplasticity theory. Number 4, eat. Eat, because our brain is hungry. So eat also need to eat wisely, because there is a nutrition theory or study that showing bad nutrition can lead to problems like anxiety and depression. For example, there is a study showing that if you have low magnesium, for example, in your food, you will have a tendency to get anxiety. Okay, if you have, for example, lack of what we call vitamin B, for example, or you have a lack of zinc in your food, for example, also can trigger anxiety. But this is not the main factor. There is a multi-factor factor which we will discuss after this. So nutrition is very important, and also most people nowadays, okay, I usually talk to my patient in clinic, because our food, our nutrition habit is not really good, because our nutrition, we tend to eat a lot of sugar things, processed food, you know, processed carbohydrate, okay, processed food like what, like bread, white bread, biscuit, pastry, lots of sugar, lots of processed food. This one also is not really good for your brain. Okay, for example, if you, because sugar itself is there is theory that that state that sugar also can cause like addiction. All right, for example, if you you know, depends on sugary drinks, for example, or fast food, and when you withhold to take the food or the drinks, sugary drinks, for sometimes you will feel, you will have some sort of withdrawal symptom. You feel like, you know, anxious, anxiety, jittery, things like that. So habit of consuming this type of food also is not really good. Number 2 is vitamin D is also very important. Okay, but we don't not always measure your vitamin D and magnesium level in your blood, actually, because this is one is costly and also is not readily available in all center. So vitamin D is very important because there is evidence showing that low vitamin D can lead to low mood. Okay, especially low mood. All right, so patient with low vitamin D can be present with mood symptoms, you know, feel like easily to get lethargy, things like that. So what is the source of vitamin D? We can get for free. For in Malaysia, we have you know, a sunny country, you know, that means you can get from the sunshine. Okay, about 95%, if I'm not mistaken, the source of vitamin D is from the sunshine. So what to do is, there is a study showing that, I will go to the point number 5 after this. I will describe a little bit about vitamin D. Okay, so right, number 5 is move and stay active. So move and stay active is in terms of, you know, exercise, you know, go for the physical activity, also can induce hormone we call endorphin. And back to the vitamin D, okay, when you move and stay active, usually you go outside. Okay, the best time to get vitamin D is between 10 o'clock to 3 o'clock afternoon. This is the best source of vitamin D. But there is a study in HUSM, Kelantan. They make a study exposure to to the sunshine from 10 to 11 a.m. for 2 to 3 times per week, around 20 minutes, is equal to you are taking vitamin D3 supplement, 5,000 international unit for 3 months. So it's very powerful source of vitamin D. So it's very actually is one of the important factor, nutritional factor, who can you know, like one of the factor that we can consider when you are thinking about to be healthy in terms of mental health. Number 6 is get socially involved, okay, with other people. Next slide, please. Okay, Al-Quran also talk about tests, okay. There's a lot of in Al-Quran is talking about a test, about sabar, okay. For example, in Surah Al-Baqarah, okay, I'm not going to in details. You can go and get your reference in Al-Baqarah 155. وَلَنَبْلُوَنَّكُمْ بِشَيْءٍ مِّنَ الْخَوْفِ وَالْجُوعِ وَنَقْصٍ مِّنَ الْأَمْوَالِ وَالْأَنفُسِ وَالثَّمَرَاتِ وَبَشِّرِ الصَّابِرِينَ. And we will surely test you with something of fear and hunger. Fear is, as my understanding, is related to emotion. He can test you in terms of emotion, stress, depression. All right. So Al-Quran, that means this life is a test. Okay. So everybody is tested. Maybe our question of examination is different. One of you, maybe Sister Faqiha, the question of for the test is different from me. So from maybe the other people also get the different set of test. Okay, is suitable to our level of threshold. All right. In also Surah Al-Mulk, okay, in ayah, second ayah also mentioned that this test, this life, he created the death and life to test you, which is the best indeed. All right. Next slide, please. Oh, I have another few minutes. All right. And also in Al-Quran they say about do not despair, do not give up. Okay. In Surah Zumar, la taqnatu min rahmatillah. Do not despair of the mercy of Allah. So there's a lot of in Al-Quran talking about do not give up. Next. Okay, in Al-Quran also said in which surah? I forgot this one. Innal insana khuliqa halu'a. Innal insana khuliqa halu'a. Indeed, mankind was created anxious. That means we are created anxious. Okay, idza massahu syarru jazu'a wa idza massahu al-khairu manu'a illa al-musallin alladhina hum fi salatihim da'imun. Except the observers of prayer who always in performing the salah. All right, so we are created in as a anxious. All right, next. And in Al-Quran also said that Rasulullah was entertained during his difficult life. And you can go to the tafsir of Surah Al-Duha and also Surah Alam Nashrah. Also, it's mentioned about the what we call the how Allah Subhanahu Wa Taala entertained Rasulullah during his difficult life. So I'm not going to be too details because of the time. So next slide, please. Okay, so chapter 2 we are going to discuss about mental health stigma. Next. Okay, mental health stigma. Number 1, mental health is a sign of weak iman, or you have a very weak iman because you have mental health. Is it like that? We are discuss after this. Number 2, pious people, soleh people, solehah people, person will not have mental problem. This is a question, stigma. Okay, this is a stigma we'll discuss after this. Number 3, mental health is a disease affected the low social class only. Is it like that? Number 4, mental health is caused by jinn. Right, spiritual things only. That means it's not a disease. It's not a modern medicine. That means it's incurable through modern medicine. Is it like that? Next. Mental health is not treatable. Is it? Number 6. Once you eat psychiatric medication, you will depend on the medication for the rest of your life. Because this question is being asked by patient. Okay, doctor, if I take this medicine, that means for the whole of my life, I need to depend on this medicine. Is it like that? Okay, we discuss after this. Having mental health means you are crazy. In Malaysia, is I don't know, maybe in other countries also, when we talk about psychiatry, that means you are crazy. You are in Malaysia, we call gila. Aku tak gila. I'm not crazy enough to go to psychiatric clinic. Is it like that? Okay. Number 8 is if I declare I have mental health, what about my future? My future is dark. Doctor, there's always a student come and ask me when he come to clinic. Doctor, you are going to refer me to psychiatric. How about my future? Maybe I'm going to facing difficulty to get a job later. Is it like that? And number 9, if I have mental illness, everybody will know. I don't want anybody to know. Because this is very, very confidential. Is it like that? That means is it necessary for other people will know? That means the doctor will tell everybody that you have a mental problem, depression like that. Is it like that? Okay, we go one by one. All right. So Faqiha, what time we will? How many minutes I have?
You can continue until the break time.
All right. Okay. All right. So stigma number one: having mental health means your iman is weak. So there's always things like that. Your brother, you need to be, spiritual. Your spiritual is very, very terrible, brother. That's why you have mental health. It's not like that. Okay. Because when we go to Al Quran, in Surah Surah chapter 20 verses 124. Okay, waman a'rada an zikri fa inna lahu ma'ishatan danka, and whoever turns away from my remembrance, indeed he will have a depressed life. Okay, depressed life, if you go to Malay translation, they say the hidup yang sempit is very, it's very sempit, narrow life, things like that. Depressed here is not referred to clinically depression, because to have a mental health, there is a several factor, contributing factor, or what we call risk factor, and then at the end you get the mental health. There is a theory called biopsychosocial and spiritual. Bio, that means hormonal imbalance, genetic factor. If you have your parents have mental health, you have the chances to get what we call mental illness compared to other people. And then not hormonal unstable, neurotransmitter theory about serotonin, dopamine, things like that. Okay, borderline personality, even borderline personality. All right, this is a very common personality that I saw in mental health patient. It's like, it's a personality which is described as chronic emptiness. Dia rasa kosong je. Chronic emptiness, unstable relationship, and have tendency to self-harm. If stress, just self-harm, cut the forearm, overdose. That is we call borderline personality. And there is study to show that borderline personality itself has related to the part of the brain who cannot filter the emotion and leads to the impulsivity. Impulsivity, that means they take a harsh, a dangerous way to hurt themselves. All right. So it's a very bad coping skill actually. So if we can see here, there is a biological issue in that patient. Number two is psychological issue in terms of way of thinking of the patient. For example, if the patient is too sensitive, and also if the patient is overthinking, also can lead to risk to get a mental illness. Social, biopsychosocial, social in terms of family support not good, surrounding is very toxic, colleagues is not helpful, very toxic, when you get a very toxic boss, so the surrounding is not good. There is social factor that leads to mental health. Number four is spiritual. Yes, spiritual is, I believe, in terms of spiritual, that means in terms of faith. If we as a Muslim like faith, faith to Allah Subhanahu Wa Taala. Okay, some people, I saw one student, as one student before. She had like a broken family, the parents, quarrel with each other, arguing with each other, the siblings is not supportive, and at the end she become an atheist. This is a real story, because she don't have the spiritual, that means the faith is lost already. Okay, so because she feels very stressful because of the what we call, maybe she had biological issue and psychological issue, but in terms of spiritual, the spiritual is very weak. So it's not only the weak iman cause you this one, but it's a lot of factor. Like nasi lemak. Why I put nasi lemak here? Because to make it nasi lemak, everybody know nasi lemak, right? Okay, I think foreigners also know about nasi lemak. It's our favorite dish. Sorry to show this picture during the Ramadan time. But nasi lemak also, you need to have, the rice itself with the coconut milk, eggs, with the anchovy, with the chicken, with the cucumber, a lot of factors that to make it nasi lemak. The same like mental illness. There is a lot of factors that contribute, not only the, the spiritual factor. There is a lot of other factors as well. Okay, next. Next slide. Pious people will not have mental problem. That means if you are soleh, if you are good spiritual, you will not have any mental problem because your spiritual is very strong. Not really. Not really, because as I discussed before, biopsychosocial issue. Spiritual, maybe he had a good spiritual, but biological, is it okay? Psychological, is it okay? Social, is it okay? I have a patient with he just graduated as in a hadith study. Is a teacher, Hafiz Al-Quran, but he has anxiety under treatment. So it's not necessary that you are good faith, you will not have mental problem. Next, please. Okay, mental health only affect the low class people only, not true necessary. Because okay, I will give you one example in a movie, A Beautiful Mind. It's talk about Professor Nash. He's a professor. It's a true story actually. He's a professor, but he's suffering from schizophrenia. Okay, we have a lot of intellectual people who are suffering from bipolar disorder. That means they have two pole of the moods, extreme and also very extreme high and extremely low. So these people, when they have the extreme one, there is two types of extreme. Now, one is hypomania, which is this is the best state when the patient's feeling that he's very energetic, he has a lot of lots of ideas, a lack of sleep needed. That means he's when if you are a writer of a song, you can create a very nice song, okay, that time during that state. But the issue is when you have depression and also mania, that means you cannot control your emotion. Sometimes you feel like suicidal thoughts, things like that. All right, so the mental health not only for low social class people is not true. It's totally wrong. Next, please. Next slide. Okay, mental health is not the medical problem. It's a gene. I used to work in Kelantan before. That is in Kelantan, I work in Kuala Krai. Kuala Krai area is a kampung area lah. It's it's a small city in Kelantan. All right. So there is people who are not really, people are not really, you trust about the mental illness as a modern treatment can be treated with medicine. They're still believing that the mental health is related to jinn. Yes, indeed, in Quran it's mentioning about sihir, about hasad. In Surah Al-Falaq or also mention about sihir, it's possible. So what actually I advise to patient is seek. You can go to both way. That means you can treat medically, and also you can go to the ustaz, for example, who can do ruqyah, things like that. All right, it's not like people who are like shaman who are using shirik like that. It's not it's not good. That means you can treat it two ways in a one time. Okay, medical and also in ruqyah through the perspective of Islam. All right, because sometimes the symptoms can be overlap. Okay, next. Mental health is not treatable. It's totally wrong, because mental health, but there is a lot of it's not really that means you take medicine today and then you will cure from depression, from anxiety. Not like that, because some patient needs medicine, some patient maybe not no need medicine. Some patient just need counseling and need therapy, psychotherapy, social support, family support, and also education. Okay, education about the mental health. So a lot of I can say a lot of treatment is needed to the patient in order to get to heal from the disease. All right, next. Faqiha, if the rest time is there, then tell me.
Right now it's 12:06. Doctor, do you think you can speed up a bit?
Can, sure. We just finished. All right. So mental health means you need to take medicine for the rest of your life. It's not true. It's not necessarily true. Depends on cases. Some disease need to be treated for a few months, for example. Not necessary. There is certain people need to be treated for the whole life. For example, patient chronic schizophrenia who relapse a lot of time. That means admitted to what frequent time. That means sometimes they need the medicine for a longer time. Okay, but for disease like depression, things like that, which is maybe you have moderate depression, there is not necessary for you to take the medicine for for the rest of your life. Okay, next please. Statement number 7. Having mental health means you are crazy. It's not true. Okay, crazy means Allah SWT give you akal, a healthy akal, okay, but you did stupid things. For example, all right, yeah, people outside there throwing, babies inside the dustbin, inside the toilets. People are doing lots of stupid things outside there. Road bullying, things like that. This is crazy. But for me, mental health is not crazy. This is a disease. It's like hypertension. It's like the other disease which need to be treated. Next. All right. If I have mental health, means my future is dark. No. Some student, before I refer, they said that, doctor, how about my future, doctor? No. Okay. It's not true. Actually, it's not true. That means this one is confidential. This is confidential. We will not expose. That means tell the third party about your illness. Okay. Without your consent, except if you ask us to write a medical report. That means if you have depression, you treated by us, we cannot, without your consent, to inform the third party. For example, your employer, for example. That means in the company you are working. That means that this patient got a schizophrenia like that. No, we cannot. We cannot expose without your consent. All right. Next. Because the moderator asked me to speed up a bit. So, okay. If you have mental illness, everybody will know. Not necessary, as mentioned before. That means this is confidential. All right. Next. Okay. Cases seen in IIUM Health Center. We finish this chapter, Ken? I think maybe 5 minutes. Ken?
And
right. Okay. For example, patient always come to us with, stress and mood symptom. Unable to sleep, sometimes patient come with back pain, frequent headache. Actually, because of the secondary to the stress, anxiety. All right, frequent headache, unable to focus in study, hypersomnia, sleep a lot, avoidance. Avoidance means they don't want to mix around people. They feel like, like very lower self-esteem, chronic emptiness. Patient come with anxious, that means easily get worried, panic attack, dying wish, hallucination, hearing voices. All right. Next. This is cases that I've been seeing during the past few years. Okay. Self-harm behavior. This one is quite common. All right. Especially for the borderline personality. Scratch with sharp object, drug overdose. Okay. Suicidal attempt. I have one experience. I think 1 hour is not enough actually to share a lot of things with you, but just that means suicidal attempt. I have a patient who tried to hang herself, and there is a strangulation mark over the neck. So this one is quite serious. It's quite serious. A postgraduate student before a few years back. Aggressive behavior, right? Irritability, shouting, screaming inappropriately, physically injure others. Yes, this happened, but it's not really so frequent. But I used to saw this kind of case. Weird behavior, isolated, poor social hygiene. Also, we got underlying abnormal social orientation. Also, that means men attracted to men. I have one patient before. He's feel very guilty, very low self-esteem, very stressed because of the abnormal sexual orientation. This is quite challenging to be handled. And number 9 is impulsivity. Impulsivity, that means poor coping skill. Like number 6 is more or less like number 6. That means aggressive behavior, self-harm behavior. All right. Next. So we stop here first, Faqiha.
Boleh teruskan, doktor, sampai break time.
Alright, and then you mentioned to me when the break time. Alright.
Sure.
So mental health actually is a multi-dimensional spectrum and severity. In the diagnosis of DSM-4, DSM-4 is like a book, a textbook for psychiatric lah. Okay? Inside there is 270 mental health diagnoses. 200, it's not 1, not 2, it's not 10, it's 270, a lot of subtypes. Depression itself also got the subtypes. All right. Mood disorder, if patient got mood disorder, is 6 to 8%. What does it mean by disorder? Disorder means if the disease severe enough to cause dysfunction in two things. Number one, in terms of occupation. Occupation means, for example, you are a student, right? So your occupation is a student. So the anxiety, the depression, or the mood symptom is severe enough to affect your life as a student. For example, your performance in the exam, in the exam will be, that means, deteriorating. For example, you cannot focus in your class. Okay, you cannot like concentrate to your study. That means it affect your life, your occupation. Number two is in terms of social. Okay, social, that means socially, before, for example, you are outgoing person, extrovert personality, always hang out with your friends. But right now, when you have the problem, that means the stress or the mood symptom is severe enough to cause social impact to your life. For example, you feel, you prefer to be more isolated, more quiet, so this we call disorder. All right. Anxiety disorder, that means mood disorder, 6 to 8% is depression, and 1 or 2% is bipolar disorder. Anxiety, about 14 to 70% of world populations. And psychosis means like you're hearing voices, you have we call delusion. That means false fixed belief, paranoid, things like that. About 1% is schizophrenia. So we are not going to detail what schizophrenia. Maybe we need another what we call time to discuss about this. All right. Next. Common triggering factor. What's triggering this one? Family issue, broken family. This one quite common. When I saw patient in clinic, broken family. Please, doctor, I don't want to tell my parents. My relationship with my parents is very poor. Okay, my father forced me to do this. My father is very strict guy. I cannot share the problem. That means broken family. That means the parents separated when during the childhood or teenagers period. That means the family is the parents is separated. So it's a family, broken family. All right. Study related issue. For example, this is quite common lah. That means okay, doctor, actually I want to study in psychology, but I got for example, they got different course which is not is their interest, so they feel very depressed, and sometimes parents force them to do this study. So actually they don't want to do it in like voluntarily. That means they are not interested in that kind of study. Study related issue is quite common. Financial issue. I have one patient, financial issue. The parents actually work quite good, but not, I don't know lah. That means they not give a good financial support, and the student herself also need to borrow the money from other students. I just tell the student that, why don't you tell your parents your problem? Doctor, I don't want to make trouble to my parents. No, you need that time. You need to be assertive. That assertive means you need to be talk to your parents. Be honest to your parents. That means assertive. Okay. The assertive attitude is very important. If not, you just like suppression. You suppress your emotion. That's why you will have then the patient end up with anxiety, depression, need to go to psychiatric clinic because of the financial issue, which can be settled if she become more assertive. The relationship issue is that means clash with your boyfriend, girlfriend, spouse, partners. Also, environment issue like COVID-19. Yes, it's very stressful. Yes, I admit that you guys are very I respect all of the students lah. That means you able to survive with the e-learning. You need to quarantine. Sometimes we also, as a doctor, we also sometimes need to quarantine. That means if suspected cases, sometimes we need to quarantine with all the roommates. I already sympathy to you, but sometimes we have to do it in terms to to manage the COVID inside the campus. And I'm for this week I'm working in COVID room. That means lots of swabs. The cases is increasing. It's very stressful as well for the student lah, because they cannot go out. But sometimes we are try to do our best to manage this situation. And number 6 is poor spiritual background, also one of the triggering factor. Okay, you don't have faith to Allah Subhanahu Wa Taala is quite weak. That means in terms of spiritual, also one of the important factor contributing to the mental health problem. Next. Underlying family history of mental illness, yes. Okay, it's a genetic possible. Poor coping skill. This one is substance abuse. When they have stress, they try, smoking, take drugs, ignorance of the symptom. It's okay, it's just a simple things. When you have a toothache, you say, oh, it's okay, like just toothache only. But you don't know, maybe there is a gingivitis, the gum is inflamed. Maybe you have a gum abscess inside. All right, you just say just a small, just a common. This is just a little bit pain only, and from the gum abscess, it can cause you to severe things, sinusitis, infection to the brain. It can lead to a bigger problem. So ignorance of a symptom is not good. That means you just say that I just have a little bit anxiety, stress like that. So ignorance of the symptom is very, very, it's very dangerous. Okay. So you need to seek help. Hesitant to seek help also is not good actually. That means it's okay, I can manage myself. They just underestimate the mental illness. Non-assertive, as I mentioned, but poor attitude, ego, suppression type of coping skill. That means they some sort of, in Malay they call pendam perasaan, okay, suppression, and bad influence from the friends. Genetic factor is also an important factor. All right, next. College, this is college and not a pressure cooker, as mentioned in 3 Idiots. Yeah, ideally is to be like this, but in reality life, actually, it's not. Ideally is to be like this, but in this world, life is a race. I think I do agree. Life is a race, but when you refer back to video, my video I show to you in the beginning of the talk, you can see that the pressure. Life is a pressure. Life is a test. But you need a guidance. You need to seek help. You need support. When you have problem, you need to get help. Okay? 2 things, the most important things. Number 1, you need to have faith first. Faith. Okay? When you have stress, number 1, you need to have faith. Number 2, Islamic view, that's what is very important, is istighfar. Istighfar. Number 2. And number 3 is seek for help. Don't number 1 seek for help from human first. This is wrong. That means you need to have faith first. And then, number 2 is istighfar. Because istighfar can give you, according to Al-Quran, it can give you strength. Okay? It's mentioned in Surah Al-Hud, if I'm not mistaken, verse number 52. Istighfar can give you strength. And number 3, seek for help. If you first depends on human, you will not settle the problem. Human is a intermediate between you and Allah Subhanahu Wa Taala. This is very important. All right. Next. I think we're going to finish this one. Okay, common diagnosis, common in our clinic is adjustment disorder. Adjustment disorder is like, when you just coming to for example, IIUM as a student, new student, okay, you have difficulty to adapt with the new system, with the university life, it will affect your what we call mood, okay, and it's severe enough to you have like emotionally low mood, things like, we call adjustment disorder. It's less severe compared to major depression disorder, but it can lead to major depression if it's persistent. Stress related condition is also quite very common in our campus, and poor coping skill, anger management, stress management, okay, which is related to daily life difficulty. Mood disorder is also quite common. Major depression. Bipolar is not really common, but depression is quite common. Anxiety, yes, very common. Panic attack, panic disorder. Borderline personality, very, very quite common. I saw in that means patient can come with anxiety mixed with depression. Anxiety we mix with other problem. For example, depression mixed with borderline personality. Comorbid with drug abuse. Okay, that means at the same time they're taking drugs, also can make the situation is more difficult. And schizophrenia. Okay, we do have schizophrenic patient in our clinic, which need to for daily medicine. All right, next. I think maybe we can rest first.
All right, Then we'll have a 5-minute break before continuing with the rest of the talk. So
All
we'll
right.
resume in 12:26.
InsyaAllah.
Okay, a reminder to all our participants, don't forget to fill in the attendance form in the description below. See you in 5 minutes.
Nak teruskan ke?
Doctor, I think we can teruskan. There's like 4 more slides or so, and then it's break time. So I think we'll
Sure,
have the
sure,
break
can.
there lah, kot. Yeah.
Okay, sure, can. All right. So we move on to next chapter. Okay, all right. Counseling. Always people asking what's the difference between counseling, psychology, and psychiatry. Okay, in brief, actually, we have counseling unit in IIUM, CCSC. All right, we have that kind of facility. It's very good. That means we have this kind of service in UIA. Psychology, we do have PSU, Psychological Service Unit in psychology department. And psychiatry, we unfortunately we don't have the service inside our university. We have in Kuantan campus, but usually you can get a referral to the nearest hospital like HKL Hospital Selayang. Okay, what is counselling? Actually, you know, it's like a counsellor that registered with the Lembaga Counselling Malaysia. Actually, they are frontliner in managing the mental health before it get worse. So, for example, how they can help you dealing, for example, cases like dealing day-to-day struggle, you know, like study issue, marriage issue, interpersonal conflict that can be settled in 5 to 6 sessions. That means it's a short. It consists 5 to 6 sessions is called a short session. All right, you can get the referral through IIUM clinic. You can come to clinic and get the referral. We can refer you to them because they have appointment. Because in our clinic, our difficulty is because we are managing primary care cases. We not only see the psychiatric cases. We also deal with pediatric cases, heart disease, hypertension, diabetes, chronic disease, you name it. A lot of other cases. So our time is very limited. We cannot see per patient 1 hour. So if a patient with 1 hour, that means yalah, right? It's not practical. So usually we just short discussion, you know, like maybe 10 to 15 minutes. We roughly got the idea. So we refer to the counseling. So they make further what we call assessment, and then when they think that the disease is quite severe enough, usually they will refer back to us. Because we like intermediate lah. That means we need to refer back to the psychiatric. We just transition place actually. Because we don't provide psychiatric medicine in our clinic. All right. So usually we will refer to the what we call to the psychiatric services. And psychology, they are psychologists. They are subdivision. Actually, they in IIUM actually is how can I say is seasonal. When they have trainees, yes, they will accept referral. When they don't have trainees, because they are teaching also the postgraduate in clinical psychology. When they have the trainees, usually they will accept reference. But if they don't have trainees, they're quite difficult for them to accept referral. So their approach is more evidence-based, clinical, because they have child psychologists, teenagers, old ages. They are like a scientist, you know, they do scale, you know, DAS score, that is a scoring to determine whether they have depression, anxiety, things like that. They also can do IQ tests, a lot of things they can do there. All right. But they cannot prescribe medicine. And psychiatry is a medical doctor like me, all right? And I specialize, for example, in psychiatry. I'm not a psychiatrist, so I'm a primary care doctor, but a doctor that specializes in psychiatry, that means they after the general medicine, they will be a specialization 4 years, and then they will get certified as psychiatrists. All right, they're handling, you know, more severe form of mental illness that require medicine, medication. So they can prescribe the medication and also admission to the hospital. So how can you get the referral? Through IIUM clinic, so we can make a referral. Next. I think. Yeah, facility. You can see a facility. This is a clinic. All right, clinic is more like, as I told you, as a transition center. All right, we don't manage like per session 30 minutes, psychotherapy. We don't do it here. Usually we refer to CCSC, and also we have PSU. CCSC usually is the frontliner for the mental health cases. Right, next. And that solve the problem? No, because mental health, no, it's not like you go one to visit and settle the anxiety, you settle depression. No, but you gain the courage to face it. Okay, you gain the courage to face it. That means, because mental health issue is not really, it's not like medicine. You take medicine or settle your financial issue, you will settle your family, your relationship issue. It's not like that. It's not like you take alcohol and you forgot everything. Just temporary, okay lah, but long term it's not good. That means it's a multifactorial problem. You will not solve the problem, but you have you courage to face it. This is a correct way, correct term to use. Okay, next. It's not helpful, search for second opinion. All right, if it's not helpful, search for second opinion. Some people that, oh, I go to this center and I think they are not really helpful, doctor, with the doctor, because this is human factor. All right, you can come back to us, we can refer to another center. There's no problem. Okay, don't just go one center, you give up already, you are not happy with the center, then that's it, bye bye. No, we can go to refer to get the second opinion. All right, next. I think that's all. Break time.
Yes, we have come
Because
to our
yeah,
break time.
we we
We shall
langgar.
have a 5-minute break. It's okay, doctor.
It's okay
We'll have
for
a 5-minute break then.
question and answer. If I don't mind to prolong, maybe before Zuhur. If you don't mind, we can prolong a little bit. I don't mind. But
Sure.
okay, not a problem for me actually. Okay, sister.
All right, then we'll have 5-minute break and we'll come back and in 12:33.
Okay.
All right, it is now 12:33. Welcome back, everyone. We will now be continuing with the rest of the talk. Dr. Zuhdi, you may take the floor.
All right, thank you, Sister Faqiha. Okay, so yeah, this is our topic actually. Stress and depression. Always, patient will use this term. I feel very stressed. I feel very depressed, doctor. So, is it stress and depression is a same term to use, or is it has their own what we call meanings? Stress is quite common. All right. So everybody is stressed. If there is no stress, there is no challenge. There is no progress in our life. All right. So as a student, you feel stressed. Also, doctors also stress. A lot of stress. This week, I'm very, it's not very stressful. I mean, it's very quite. My coordinator of COVID said there is ibarat. Sorry, I use Malay term. Ibarat dilanggar todak. Okay, if the foreigners, I don't know in English word. That means we are very, very busy this week and it's very stressed. But if there is no stress, there is no achievement. Okay, because this stress give you the for you to perform better. Okay, so but the issue is not everybody can take it. I mean, can what we call can face the stress. It will lead to depression. So what is the main difference between stress and depression is that I usually ask patient, okay, what is your hobby, sister? Oh, sister, a very simple question I will ask. What is your hobby, sister? Oh, doctor, I like to play football. Usually I like to play football. I like to go to watch movie before MCO lah. Right. I like to, play futsal. If lady, I like to, writing. Okay. Right now, do you still have the, what we call, interest to do this kind of things? Oh, doctor, I'll say, okay, I still enjoy, and I mean, I still can play football. I can still hang with my friends. I have stress, but I can still enjoy my life. So this is not depression yet. But patient with depression, they will have, loss of interest. This is very triggering, and that trigger us that this patient has depression. Oh, before doctor, I have, usually I will play football with my friend, play futsal. I will always hanging out with my friends, chit chat with my friend, blah blah blah, hang out. But right now, I don't have, I don't have that kind of interest. I rather be in a room. I don't want to mix around with other people. I don't really feel enjoy of my life. We call anhedonia. Okay, so this trigger what we call depression. This is one of a big criteria of depression. All right. So next, please. Okay, stress. No, I think there is before there is about depression. Oh, maybe next slide. Okay, all right. Back. Okay, no, back. Okay, stress means you are weak, not necessary. Stress doesn't mean you are weak. Okay, that means you cannot handle this kind of this one. That means you are very weak. It's not really, because every person have their own threshold. Okay, maybe my stress threshold compared with my other colleagues who are specializing in more, in a more challenging field in medicine. For example, in obstetric gynecologists, they are working in hospital. Their stress threshold is higher than me. Maybe if I'm in their place, I cannot take it. That means my threshold is not that up to that level. So doesn't mean I'm weak. Maybe my ability is in this field. Okay, that means everybody has their own threshold. Every person has their own upbringing in their family development. For example, if a patient, his upbringing is from that means his father is a soldier, strict, very strict, very disciplined, compare with another patient with upbringing in like live in a luxury life, spoiled by the parents. Maybe in terms of threshold stress, both of them is not equal. So we cannot simply that you are weak, but this is about the stress threshold and how you manage your stress. So that's the issue. Like that, we cannot simply judge this. You are very weak. No, not really. All right. Next. Depressed is not just sad. Because say, I'm very feel depressed, doctor. No, because depression we have criteria to use. Okay, I usually use this one. Miss Chu. Miss is not really miss lah. That means it's like M is stand for mood, persistent low mood for more than at least more than 2 weeks. Persistent low mood. All right. I is loss of interest. Okay. S, sleep problem. Another S is suicidal idea, suicidal intention. This is depression. This one. C, poor concentration. E, energy, lack of energy, feel easily get tired, lethargic, things like that. W, loss of weight and loss of appetite. Another W is worthlessness. You feel like, yourself is worthless. You feel like guilty. This is depression. P, psychomotor agitation. You feel, easily get anger and also psychomotor, or you can be presented with psychomotor retardation. That means you do feel like, it's not easily get anger. That means you don't have feelings. You don't have emotion, lack of emotion, called psychomotor retardation. But the core symptom is sad and anhedonia, as I mentioned before. Loss of interest, not enjoy your life anymore. There is a lot of another example, like biological disturbances. Patient will come with like another symptoms of abnormal menses. Sometimes student will come. It's quite common. Student will come and, doctor, my period is not regular. Like already 3-4 months. My period is not regular. Okay, no period. Okay, and the student is not yet married. So yeah, number one, if patient with no menses, we need to rule out pregnancy. But since patient is not, is not married, and also she deny any relationship with things like that. It's quite another common causes is stress, and also the mood that cause the biological disturbance. Cognitive is no focus, forgetfulness, and guilty. Next, and the patient also, next slide please. And the patient, next slide. Okay, depression, patient will come maybe not in sequence. Maybe the biological comes first. Okay, biological comes first. That means in terms of menstrual problem, like energy, and maybe the behavior. We always can see the behavior, less active. Before he's quite active, right now more isolated, more quiet. So this the change of behavior that is always can be seen. At first we can see lah, compared to other symptoms. But as I told you, this not comes in sequence. Mental health is very complex. Maybe anxiety comes first. Maybe coming with panic attack. So it's not like typically like depression. It's not necessary like that. So I just give you the rough idea. All right, next. And the behavior warning sign is self-harm. Okay, self-harm is quite common. Okay, a few days back, I got a patient with drug overdose. All right, because he was scolded by the lecturer. He want to be exempted from the exam because he's not feeling well. Okay, he's on medication. Okay, and then I don't know. Maybe there is a misunderstanding there. So he becomes so impulsive. So he have panic attack. And then he overdose drugs. So we need to refer them to the emergency lah. So this is self-harm and also suicidal. He don't have the idea for suicidal actually. He just do it because he think that the overdose will relieve his panic attack. So this kind of behavior, then sometimes we need treatment. Okay, I don't scold them because if people don't understand this one, they tend to scold patient. Hey, why you like this? You are very weak. You are blah 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 blah. This kind of borderline personality, as I mentioned earlier, is related sometimes to the brain itself. It's proven by the study that showing that the patient with part of the brain is cannot filter the emotion and tends to do things which is impulsive. Like self-harm like this. Social withdrawal also is a warning sign. A behavior that we need to monitor. That means if you have your friends, before she's not like that. That means change of behavior, social withdrawal like that. Okay, please just can get help from principal or your fellow. All right, just tell that I'm suspicious this guy might have a mental health problem. I have one patient before, isolated, like socially quite weird, and then the friends, luckily the friends are very concerned, and then they ask help from the principal and also fellow, so that they bring the patient to the to the counselor as a frontliner of the mental health. So they refer to us, then that's good. That means you need to be concerned about your friends as well. Suicidal thoughts. Suicidal thoughts also is not good. I wish to die, doctor. There is a suicidal thought and also suicidal attempt. Thought, that means just thinking. I wish I will die, but they don't dare to do it. But some people are dare enough to do it. They try to jump from the building. Okay. But most of people not really, just acah-acah, sometimes to get attention. But when patient tell me that they want to commit suicide, feel life is worthless, things like that, that means this is what we call warning sign for us. Aggressive behavior also a warning sign as well in mental health. That means this kind of behavior. Sometimes a patient with depression can come with aggressive behavior. They cannot control anymore the emotion. Next. Okay, we almost finished. Can we measure the mental pressure like blood pressure? So we have the gadget and measure. Okay, this is the pressure. That means the pressure is very high for your mental. It's not a gadget like that. We have next slide, please. So we have like questionnaire like this. All right, but this one you need to be used with assistance of healthcare professional. Also with the mental health providers, like psychologists or counselor. All right. In Malaysia, they have there's the link there. Right. You can see DAS score, depression, anxiety, stress scale, DAS 21 in Malay language. Also, there is also in English language, and also the back depression inventory. That means a scoring system that you can answer. There is a question and you just answer, and then you can this one. But this one need to be done under supervision actually. But this one maybe you can do it first and then consult the mental health professional. Next. Okay, is it anxiety a big issue? Yes, it's a big issue. I have just few days back, I swapped a staff with there is a history of close contact with COVID patient lah. So patient just sit down and then feel restless. I said, why sister? So I feel very anxious, doctor. Okay, all right, you just rest first. I think that means make a relaxation technique. Okay, that we call a deep breathing like that. Okay, then I proceed with another swap with other patient. So when the patient come back and they say, okay, I feel better, doctor. Okay, can please do for me? And then after the swap, I tell her, what was your problem, sister? Oh, I have anxiety, doctor. Do you know that anxiety is can be treatable? Oh, I don't know. Is it can be treated, doctor? Yes, of course we can treat. That means, and then we make that means that people don't know. People just say that like anxiety, like anxious, is it can treatable because maybe she don't have the information. So is it big issue? It's big issue, but it's treatable. Next. Anxiety and depression can overlap. Okay, anxiety like we call easily get worry. In Malay we call risau memanjang. Risau memanjang. Kalau if I Clark Malay version, you have like risau, sikit-sikit risau, and easily get worry. Even a small things get worry. Okay, some people may have the kind of attitude. But is it disorder or not? Depends on the two things, occupation and social. If affect these two things, is disorder already. Trembling, shaking. Okay, for example, you say that I feel anxious when I want to make a presentation. Is it impact your life as social and occupation? If impact, yes. But because anxious, I mentioned earlier in the Quran also said that person is created in anxious. Khaliqah halu'a. That means that created is anxious. Is not wrong to be anxious because we need that one, but excessive anxiety is not good because it will impact your social and also your occupation. Feeling nervous, heart rate very, very fast. Okay, but anxiety you need to know there is if you come to clinic, we need to rule out certain diseases like heart problem. We need to do your ECG first because sometimes the heartbeat is abnormal, can cause symptoms like anxiety, and also the thyroid hormone. Okay, doesn't mean that anxiety is a purely a psychiatric problem. No, it can be a medical problem as well. It's manifest by anxiety. All right, next. Okay, this is GAD, generalized anxiety disorder, excessive anxiety and worry, fatigue, restlessness, difficulty in sleeping, irritability. Okay, as I mentioned earlier, there is a biopsychosocial, spiritual, and also nutritional issue as well, which is not really is also quite important factor as well. Okay, but generally anxiety disorder is actually you need to have this kind of symptoms, if I'm not mistaken, at least 6 months persistently. Then this one is treatable. Sometimes it depends on the severity, maybe you just can go for the psychotherapy. Okay, some patient needs medicine, but is it for whole of your life? Not necessary. All right, not necessary. Okay, next. Signs of panic attack. Panic attack, that means sudden, this is like, that one is GAD. GAD, that means continuously having, on and off, on and off. This one comes in attack. That means you are reading, without any physical activity, just watching TV, for example, and suddenly it comes like heartbeat very fast, sweating, chills, nausea, hyperventilation. That is quite common, this one. Panic attack. Numbness, tingling, dizziness, trembling, shaking, fear of dying, choking. Okay, this is called panic attack. But this one also, we want to rule out heart problem as well. Okay, there is heart problem, abnormality in the heart as well is one of the causes, and also thyroid hormone also we need to measure. But if all is normal, then we can blame the panic disorder. This one also, is it big impact? Yes, of course. If it impact your social and also a performance as a student. Next. E-learning issue and mental health issue. Okay, we can go fast. All right. Next. E-learning, there's 3 challenges. Number 1 is techno stress, because you need to use devices for long term, that can cause mental, physical, sleep problem. Physical stress, because you need to stay in front of the screen. Even me, if I speak, in front of the screen for 2-3 hours also, I feel very stressful, because this is not, I don't know how you guys make it, I don't know. So that's why I don't have any experience facing this problem during my time lah. That means, it's quite stressful, physical stress, bad posture, sometimes you lying on the bed, and also mental pressure. You feel sad, lonely, anxious, a lot more assignment. I heard, that means, because online, sometimes lecturer give you, lots of assignments, that makes more life is very more stressful. Next. So how to cope? Next, please. Okay, sorry. Okay, good side of e-learning is less risk of COVID-19, of course lah. So safe course traveling, physical distancing, but physical distancing, not social distancing. That means you still can socialize, but physical distancing. But bad effect is quite a lot actually, because not all is good in have a good internet connection. If poor support system, that means if you're at home, your parents don't understand you. Sometimes you're hearing to the lectures, things like that. Your mother asks, "Hey, come to eat. Hey, go to buy something from the market, things like that. Okay, please throw the rubbish. Cleaning the house, everything." So you're very stressful, because if parents don't understand, so you cannot separate yourself as a student and also as a child, as a son or daughter. Okay, take no stress, of course lah. In front of this one lah. Old school teaching, maybe I don't know, maybe the teacher is not familiar with the new technology, so they unable to make full use of technology, and lots of assignment. Next. How to cope? Okay, you need to separate yourself a role as a student, son or daughter. So when you go to class, make sure that you proper attire. Like you go to the class, not just wearing singlet, for men right? And then kind of play card, and then you watch lecture. You means you take bus. Okay, you wear properly, like you go to the for the girls, for the ladies, maybe you can wear proper attire. That then when you wear, even when you at home, that means when you that means you wear proper attire, so that you just put right, comb your hair, things like that. That means, your mother know, this my daughter is having lecture right now, so I don't want to disturb her. So you separate role of yourself. You differentiate yourself a role as a student, as a son and a daughter. Okay, camera on. Okay, you need to put the camera on so that you feel like you are in actual class. Proper ergonomics, okay? Proper ergonomics means, proper posture, not just, lying on the bed, and then, so this is very, that means make sure that yourself, you are in the arena just like in a real class. Next. Print out the schedule, okay? Print out schedule, all right, put on the wall so that you feel like you are in a real class. Okay, after this, from 2 to 3, I have this class, and then after that, this one, and then next is when. So that means you put the aura. Even you are in online class, that means you create an aura. Okay, social activity after the class also very important, like playing games. I don't know, some recommend, Among Us. There is a game called Among Us. I don't know. I heard about this. Maybe I never played this game, but I heard from a psychologist, and he said Among Us game. It means after the class, so that you can create what we call still have social activity. Maybe after the class, you can talk with your friends, something not related to lesson. Maybe talk about football. Maybe talk about a new fashion. Maybe for the ladies, a new tudung, or fashion. You buka for the iftar. What you cook for iftar, for example. All right, and showing what you are eating after iftar. Okay, I'm eating this one. Hey, yeah, I'm eating this one. I'm eating this one. Like you are interacting in a class. All right, and you should have digital free time. You should assign. That means, okay, my class like this. That means you should have a digital free time. That means you can go outside, have fun, with your friend, with your family member and things like that. Not just, all the time with the gadget. Self-treat after finish one assignment. Okay, that means after you finish one assignment, okay, maybe you can buy some food, like anything, your favorite food, and then okay, this one is self-reward for me because I able to finish. Just talk to yourself. Alhamdulillah, I finished my assignment, and you self-reward yourself. Okay, that's one idea to boost yourself and think positive. Yeah, this one, think positive lah, because like stress is like a vaccine. When I got my vaccination, second dose Pfizer, what happened to me is that I have fever, I have body pain, feel like, oh my God, that means feel like I'm having COVID, very bad condition, that means especially the second. And after that, alhamdulillah, that means, maybe because the immune reaction, things like that. So after that, I'm okay, alhamdulillah. But I didn't check because there is certain way to check your immune system, but we don't do it. But we are expecting the immune system is higher. That means it's more resilient. That means it's like a stress. When you're facing a stress, it's like a vaccine process. So that means you are facing a very tough challenge like now. Again, maybe after that, right now, when you are facing, more or less a difficult situation, you can able, because you are already facing a more difficult challenge during your study time. So it's like a resilient process. Next. So you almost finished, next, sister. All right. Okay. Take your hand in this is my favorite movie, I don't know whether have you watched this movie or just 3 Idiots. Very nice movie. Take your hand, put over, and say all is well, all is well. So however big the problem, tell your heart, all is well. So actually it's good. Let me see, you try to make yourself calm actually. So you can see this guy, the name is the actor played the role as a rancho, and his friend is very, is fear of failure. This guy is very good, but his fear of failure, that means make himself, not study very smart, work very hard and put a lot of stress. So it causes anxiety. This one is good actually. So you need to be friend with people or person who are friends who are positive thinking. Okay. Next. How can you help your friends? Next. Be like this. Be like makcik who's selling nasi lemak. Makcik means elder sister, but you need to be careful when you use term makcik and kakak. Kakak is younger lah, younger sister. Makcik, very sensitive for lady. If you call kakak, it's better. Be like her. Why I say like her? Because you need to be like her, a friend like her. Why I say like that? Because when you never heard that people who selling nasi lemak force you to buy her nasi lemak. You must buy my nasi lemak. This is very tasty, you know, this is a very delicious one. No, what she do is they preparing a good dish, you know, cook, with ayam goreng, with a nice sambal, with a nice, you know, aroma, and then people come and oh wow, it's very nice one. Same like you. That means you for example, you have friends with you suspect you have like stress, things like that. You don't force her. Say, hey, tell me lah, what is your problem? I will help you. You cannot just force her to that means to hear you, but you need to show yourself like you are ikhlas or sincere to help her. Okay, for example, then you can tell your friend, sister, I'm here to I'm ready to help you. Probably if you need any help, you can text me anytime. Maybe we can have a chit chat. Maybe we can go to drinks together. If you want to share your problem, I don't mind to help you to hear your problem. Maybe I'm not a counselor, but maybe I can help you to refer you somewhere, things like that. So you just show that you want to help them, okay, not forcing them, because some people, the coping mechanism is they don't really like to share privacy things. When you do like this, sometimes student, your friend will feel more open to discuss about her issue. Well, that's what I do in my clinic actually. That means we open the question. I don't force students to tell the problem. I just open. That means if you want to share with me, yes. Because sometimes patient will find that certain issue is quite sensitive for them to share with me. Actually. Okay, right. Next. So I think we almost finished. The conclusion is, okay, stress and depression, anxiety can give a bad impact to yourself if not treated properly. So seek for help, avoid stigma, and gain more knowledge. Okay, this 1 hour is not enough. Okay, of course, I don't feel it's not enough actually, but it's good start. Okay, as I told you, I'm not a psychiatrist. I just share my experience. I just want to share my experience only. So you can go to read books, psychological first aid. We have Facebook Laman Minda. Well, Minda is organized by psychiatrists in Malaysia, but it's in Malay language. In YouTube, there is our psychiatrist, Dr. Rozanizam, also has his own YouTube channel, and he's sharing lots of information about the mental health, and also helps your friends. You don't need to be a psychologist or counselor to help your friend. That means you be like a kakak who sell nasi lemak. Alright? Alright, I think that's all. Sorry for actually I'm taking additional time to finish. I'm so sorry to the moderator. Maybe we can take question and answer. I don't mind to prolong this session. Yeah. I give back to you, Faqiha.
Thank you, Dr. Zuhdi. That was really enjoyable. And yes, we should all try to be like the kakak that you just showed us. And now we will be taking questions. As a reminder, you can submit questions in the comments section. So our first question is...
Okay. I just read it and answer straight away.
Oh, okay. So I can read it for you then, and you answer it?
No problem. You just can read it for me.
So, all right. So from a question from Sister Shahida. Now we want to know how do we know that we are suffering depression if at the end we think we are actually faking it, or are we just overthinking?
All right, it's a very good question from Sister Nushahida. It's a very important question actually. So how do we know that you are suffering from depression? And at the end, it's just like overthinking. You need to understand what is overthinking, what is depression. It's two totally different things. Overthinking is, as I mentioned before, for mental health, is biopsychosocial spiritual factor that is mixed together and contributing to the what we call mental health. For example, depression. All right. Overthinking is part of your what we call a psychological, biopsycho, the psycho part. That means overthinking, sensitive. That one is one of the risk factor, which if it mixed with other factor like social factor, like broken family surrounding is very toxic and can lead to depression. And depression has criteria to diagnose. Okay, I just go back to the criteria to diagnose depression. That means it's not only just sad or overthinking. It consists of persistently low mood, at least more than 2 weeks, loss of interest, sleep issue, suicidal thought, but not necessarily all need to be together. There is a severity. Maybe patient just have four entity only. But the most most important core symptom is anhedonia, not enjoy life, and also sad. These two things must be present. Poor concentration, what we call less of energy, worthlessness, loss of weight, psychomotor agitation. All these is symptoms of depression, but not necessarily you will have all of the symptoms. So when you have part of the symptom, also you can consult us. Okay, you can go to counseling or things like that. All right. I hope answering your question. Huh?
Okay, question from Sister Sophia. She asked, is it disrespectful to the mental health community if someone says that he or she is depressed when they are not medically diagnosed with it?
All right. Okay, this is also a very nice question from Sister Sophia. Okay, it's a quite important question. Okay, because we are judge people, because we are using the term incorrectly. That's why I during my talk just now, I just mentioned what is stress, what is depression, because people misuse the word depressed, because depression there is a criteria. Okay, and if say this guy got depression, this guy got depression, maybe they has, yes, that means they has a symptom of depression, but you just like labeling people like that, it's not helpful. Your job is not labeling, that means help. You try to be like the kakak who selling the nasi lemak, that means not just labeling, that means ideally you need to bring the students, ask the students, say, okay, hey, why not you go to this one? I think you need, do you think that you need help? Maybe we can help you, or go to counseling, things like that. So is it disrespectful? Yeah, some sort of it, I think. Because depression is a clinical diagnosis. So the diagnosis of depression should be made by the professional, the counselor or psychologist or the medical doctors lah, especially the psychiatrists. I hope answering your question.
All right, the next question is from Sister Yasmin. I've heard that most of the makcik always said that ni mesti tak solat, etc. How to educate the makcik regarding this issue? What is your opinion, doctor?
Very interesting. How to educate? It's very, very tough lah, because to educate someone is older than you, I think it's not, sometimes, you are, and it's a very, very good question. First place is very good question from Sister Yasmin. Judging, that's mean labeling. Judgment, that means, oh, this one, that's why I highlight in the stigma. You have mental problem, di mesti tak solat ni, that means you have a weak iman. No, that means mental health, spiritual is one of the factor, but there is other factors as well, biopsychosocial. All right, but you cannot tell the makcik lah, makcik, but you need to see that the level of education of the makcik, right? Why you want to argue with the makcik, right? Maybe the makcik, the education is low, right? You want to educate her, so no, it's waste of time lah. Except she's like ready to be teach, or to be to be educated by us. So why you wasting your time to quarrel with the makcik, things like that? For me, that's why we need give proper education to the public. Stigma of the public. Okay, labeling, just saying that mental health is a weak iman. It's not true. Is part of it, yes. Spiritual is one of the triggering factors. As I mentioned in just now, in the second stigma, which is pious people, soleh people also got mental health problem. I have a patient with Hafiz Quran. He's Hafiz Quran. A second case, that one, the first case, another case I saw is Hafiz Quran, and he feel like, doctor, I feel very, very empty. I already read the Quran, I already perform the solah, but I still feel very, emptiness in myself. And I diagnosed him, probably he has depression. Okay, depression or bipolar. Okay, bipolar. Because depression, sometimes patient bipolar will come, maybe presented with depression first, and then at the in the part of the life, maybe there is a essence of hypomania or mania, extreme high mood. So this patient hafiz Quran, you know, he's very soleh. We can say that soleh student lah, but Allah test him. That means in terms of biological, maybe he has hormonal imbalance, maybe he has family history. In terms of, you know, psychological, maybe he has overthinking type of person. Okay, in terms of personality, social, maybe he has, you know, underlying another, you know, surrounding is not good. That's trigger the problem. So we cannot judge like this. So how to educate depends on the education of the makcik. If you think that it's quite difficult to educate, I think no need to waste time lah to argue and give her the lesson lah. Okay, all right. I hope answering your question, Sister Yasmin. Madiha, Madiha is our
yes.
moderator.
It is our PM, our program manager.
Online made
So,
by
yeah.
people who use it to cope with mental illness. Deprecating jokes online made by people who use it to cope with mental illness. It's valid coping mechanism or can be damaging to people. For example, can you give example? Self-deprecating jokes online made other people
I think a self-deprecating joke is somewhat along the lines of, like they're not somebody who's worth it. Like, I'm I'm trying to think of an example that I've heard some of my friends say. It's kind of like you lower your self-esteem or your self-confidence, you know, by saying something that demeans yourself. Something like that, doctor.
Oh, okay. That means, is it a valid copy? Okay. Actually, I'm not really clear with this question, but I try to answer that. Yes, there is a good and bad coping mechanism and when handling stress. Maybe I can answer the question in general because I'm not really understand what does it mean. Maybe Madia can PM tepi me after this to ask. I'm not really this one get your question, but there is two types of coping mechanism: good and bad type of coping mechanism. Good type is when you have stress, you divert it into what we call good things. For example, if I'm stressed, I go back home and I cook, and then I found new recipe, for example, and I cook a new recipe, and then I feel very nice. So I convert my stress into good one. Okay. Some people has, for example, when she has stress, he or she divert it into, you know, like planting flowers, or maybe, you know, cleaning the house. So it divert into the good way. Other coping mechanism, there's a lot of coping mechanism or defense mechanism lah, which I think is not is very long, is big topic. That means they convert the stress into bad one. Okay, like, you know, punching the wall, you know, other types. That means being a rude bully or being a toxic boss or toxic leader. For example, maybe she go back to home and scold the children. So this is a bad coping mechanism or defense mechanism. I think that's what I can answer for this moment. All right. You can be Noor. Yes, Noor. I want to ask if you can.
Yeah. Okay.
Question
So,
for
the Sister Noor says, I want to ask if I register for counseling in iMaklum and join the Skype session with an available counselor there, will they be able to diagnose my issues if I have any?
All right. As I mentioned before, okay, thank you, Noor, for an interesting question. All right. So she said she already registered for counseling and joined the Skype session. Okay. So as I told you, counselor is like a frontliner for mental health. So will they able to diagnose? Yeah, for at some extent, yes. But sometimes they need to refer back to us to confirm that diagnosis. For example, they can diagnose depression. You know, they can diagnose, okay, this patient got anxiety. This patient may have, you know, autism spectrum maybe, or he have, for example, what we call ADHD problem, attention deficit hyperactivity disorder. For example, they can make, you know, like what we call, they know that there is an essence of that disease, but to diagnose it, sometimes they need to refer back to us and or psychiatrists to make a proper diagnosis. But if just like mild depression, which is or anxiety, which is can be settled in 5 or 6 sessions, yes, they can diagnose. Uh, but if during the session they found the severity is quite severe enough, they need to refer back to the doctors lah. All right, for the management. All right, I hope answer your question.
Okay, next question from Sister Anis Zulaika. Someone I love has been diagnosed with schizophrenia. May I know what is the best way for me to help her?
All right, okay. Very good question from Anis Zulaika. Someone that she loved diagnosed with schizophrenia. Oh, schizophrenia is a major mental problem. When I work in Kelantan before, most of my patient, I work in community psychiatry. Community psychiatry is usually we go to the house of the patient and then visit them. Okay, criteria is like patient with schizophrenia with frequent relapse. That means they admitted to the hospital many times. Like poor social issue. For example, they come from very poor family, don't have transport to go to the hospital. When we go there, we visit them. I have one makcik okay. For the foreigners, learn a lot. One makcik this one old lady lah. She's very poor lady lah. She had her daughter diagnosed with chronic schizophrenia. Okay, how she need to take care of the patient. Schizophrenia patient for chronic disease. Sometimes they, in terms of function, she cannot function as this one lah. You cannot expect this patient to help you to cooking for you, cleaning the house. Sometimes you need to take care of her self hygiene. You need to take care of the medicine. The makcik need to need extra money to support for this patient. So how can you help this patient? Is number one is social support. Social support can be in terms of you I don't know whether you're staying with the patient or not, but you can be I don't know who is your loved one, maybe your family members. Maybe you can offer, make yourself like a makcik jual nasi lemak. That means the kakak who selling nasi lemak. That means you make yourself as always ready to help her. Okay, so that she can, or I don't know, he or she can always, if she had problem or stress or any problem that maybe he cannot control herself, then they can call you maybe and sharing the problem with you, and maybe you can take care of her medicine, and when is your follow up, whether they take medicine or not, in terms of that. That's why I show the first video. The first video is a symbolic. That means during the race, okay, that means support from family members. Okay, is for them because they cannot walk. They cannot walk because of the pain. All right. So you need to give them maybe walk together with you. Just exactly like in the video I showed you before. I hope answering your question.
Okay, next question from Nur Alia. Some people like to self-claim or self-diagnose themselves as a person who are suffering a mental illness. Are those actions also related to mental problems?
All right. I think we cannot. Okay, thank you for the question, Sister Nur Alia. A very good question. All right. Some people like to self-claim or self-diagnose themselves as a person, self-diagnose. And then is it a patient is related to mental problem? It's not really related to mental problem, but the what we call the attitude or the action that means, as I told you just now, sometimes people have toothache. They just say, oh, this is just normal toothache, this is not really severe, because you are not a dentist. You are not expert in teeth, Even me, I also don't know how that means if related to oral things. That means it can be a gingivitis, for example, inflammation of the gum itself, which is you just assume this is just a normal one, and maybe this is an abscess, that means a pus inside the gum. We don't know, but it presented with a toothache. and then it will be complicated to the got the sinusitis and infection go to the brain. It will be a very serious problem. That's why self-diagnose yourself as a mental illness without seeking help from expert is very dangerous, because you tend to underestimate your problem. Maybe you have depression already, but you say, I just a normal depression. That's why it's ignorance. This is nothing. They try to Google. In the this one internet. Okay, Google. Oh, doctor, I think I have bipolar disorder. I think it's okay lah. That means I can clarify. But if just go to the internet and then search, and then this one is mild depression only. So okay lah. Alright. So just go to the DAS score, self-do, and then this one is low score. That means I don't have this problem. This mental health, because the scoring is low. But you don't consult the mental health professional, and then you are suffering after that. So this is not good actually. So don't underestimate. So this actually is related to mental problem. It's not really, but it's dangerous to self-diagnose. Okay. Next.
Okay, next question from Nur Shahada. Could you provide some suggestions on how to cope with suicidal thoughts?
Okay, this one is quite general question. Okay, number one is need help. Need help. Suicidal thought, as I told you, this is a dangerous sign, warning sign. It's not something you can take it lightly. Oh, just suicidal thought. I still can handle it. Sometimes patient will when she drive a car, she just feel that sometimes she want to just speed. Hopefully, I will have accident after this and I will die. So it's very dangerous. It's just impulsivity. So how to cope with this one is you need to come. Number one is I cannot give suggestion through this one. Number one, you need to come to see us first, because we want to identify why you have suicidal thoughts. What is triggering you to have suicidal thought? How much extent the suicidal thought is. That means maybe you already bought the medicine, or bought the poison, for example. So we need to assess it. Okay, it's not something that you need to get assessment first. Maybe you have depression, maybe you have other type of mental problem, maybe you have the problem with what we call the coping skill, maybe you have a problem with anger management, maybe you have a problem with other type of mental illness, that for example borderline personality, which is not easily just you do this. No, this one need therapy, sister. Need a session with psychologists and counseling for few sessions. It's not something that do this and this one settle. No, you need to be personalized. Okay, Shahada, I think I hope answering the question. Next, it's up to the moderator lah, whether we want to accept more question. I'm okay.
Oh, we're okay as well. I
So
assume.
already.
So next question.
It's okay.
Right. So next question is from Sister Faqiha. If my friend is facing an anxiety attack, what is the best thing to do, or any reassuring words or actions to do in order to calm them?
Okay, anxiety attack. Okay, thank you for the question. And this one is quite common during exam time. During exam time, patients come with anxiety, panic attack because of the there is a patient who cannot, a type of anxiety with when they sit in a hall, in a confined space, he has tendency to get the panic attack. So that's why sometimes this kind of patient need to do a special exam. So that one we need to assess. So when they are facing anxiety attack or panic attack, okay, the best thing to reassuring is, if this is disorder already, this one need medicine. This one need to be treated. It's not that okay, you can. That means number one you can do is ask the patient to do relaxation technique. Relaxation technique is just take a deep breath. Okay, breathing technique. This is very simple. Which is, well, for example, this one. If this one happen, you go out from the building, for example, and take deep breath. The deep breath from the abdomen, not from the upper one. That means very deep breath. Hold for a few seconds and then exhale. Okay, then inhale, exhale. Okay, because this one can help for relaxation. This is the simplest thing you can do, because this one is during the panic attack, or we call it panic attack. The heart very fast, things like that. So when this patient come to clinic, what we'll do is usually we will breathing technique as well, and also we will do ECG as well, because this one can be because of heart problem as well. Some patient will have abnormality of the heartbeat, so we need to rule out organic causes as well. Okay, rather than just blaming the anxiety because of the psychological issue. All right. So the simplest things is, number one is relaxation technique, and number two is bring to the clinic lah. Okay, sometimes we need to give medicine to make the patient relax. All right. Next.
Next question is from Sister Alia Shafiqah. When I have problems, I always cry alone and rarely share it with anyone, even with my family. I started to talk alone to myself to express everything. Will my behavior lead to any mental disorder?
Okay, this is very nice question from Sister Alia. So when she had problems, she always cry alone and rarely share. So that means she's quite secretive lah. She don't want I think this one is type of suppression coping skill. Suppress, that means you pendam. Pendam. In Malay they call makan dalam lah. For the long term, it can if you suppression for long term is not good. This is one of the biopsychosocial factor. That means you can in psychological entity. That means biopsychosocial, the psycho one, which is in terms of overthinking, lack of good coping skill. This one is sorry to say, this is not a good coping skill actually, because it's like a volcano lah. It's like a volcano and it will burst suddenly, and this one is not good. I mean, you are a risk to get mental health problem. Yes. So what to do is, you need help, sister. This one you need help in terms of coping skill. You can go to counseling, because some students used to come to see me and said that, doctor, I don't know what to share with my friend. My friend don't understand me, doctor. It's okay, because your friend is not trained to hear your problem. Okay, but the counselors, psychologists, they are trained to hear your problem. They are trained. Okay, their job is to hear to your problem. That's their job. That's the nature of their job. Then they get the salary to hear your problem. So use the facility lah. All right. So sister, this will your behavior lead to any mental disorder? Yes, there is risk. There is a risk, but not necessary. Okay, depends. Your stressor is very high enough that it can make what we call a risk to get mental problem. For example, depression, anxiety, like that. Okay, hope answering your question. Next.
Okay, the last question is from Sister Shahida. Fresh grad nowadays receive lots of rejections when applying for jobs. The rejections sometimes bring depression among them. So what is your advice regarding this situation?
Okay, sister. All right, this is a very challenging question. Right. No, Shahida, very tough question, I can say, because this one is related to job, financial issue, which is, you can say, a biopsychosocial issue, which is the what we call the social one, which is financial issue, surrounding issue, which can lead to yeah, I agree with you. If you have biology, that means underlying imbalance, hormonal imbalance, neurotransmitter with like the way of your coping skill is poor, plus the surrounding issue. Yes, that means they can bring depression. Yes. So what is my advice regarding this situation? All right. So number one is, because maybe like during my time, when I graduate from medical school, it's easy to get a job during my time lah, because that one, when you go for interview, is confirmed you will get the job, because the job is quite critical that time. So it's easy for fresh graduates. Yes, it's very challenging. So what to do is, number one, as I told you, number one is quite difficult lah. Number one is face. Faith. And number one is faith. That's why I told you, number one is faith. Faith in Allah Subhanahu Wa Taala. But this one is inside you lah. That means you need to faith. That means this is one of the tests. Every person got tests. Even me, okay, for example, I easily to get job, but my test is different. Okay, maybe my test is in different different examination question. All right, my test is maybe during working times. That means you need quite stressful, during my houseman time, very stressful. That's maybe I easy to get the job, but during my work, sometimes I'm thinking of quitting the job. You know how many people are getting the job but thinking of quitting the job because of the toxic environment. So you was tested as like this. Yeah, that means that means maybe you need in terms of this one, maybe you need to look for because this one related to financial, right? Maybe different get different opportunity from government. For example, maybe they are giving like short courses that for business, for example, things like that. But in terms of spiritual things, this is like every stress, every challenges is you can say as a resilience process. It's like a vaccine. Maybe this time this is the test. That means very challenging for you. Maybe later Allah Subhanahu Wa Taala want to give you something nice. But this is related to faith, sister. Okay, this is not easy. Yes, I easily can say to you, but I think this is a test. Every people, it's not. For me, it's not a really a problem because I'm easy to get the job. But for you, this is your test. Our test is different. You like this. Maybe Sister Faqiha is different test. Maybe this guy is different test. So everybody is tested. That's why I put in my slide first is this life is a test. So be prepared. But inshallah, every problem got solution. Fa inna ma'al usri yusra. Every difficulty will have followed by easiness. Allah will not test you based that means based from your iman. He know your iman level. You can take it. That means this level you can take it. I used to be tested in my life. I just share with you. Maybe it's quite confidential lah. I used to further my study, in as a specialist, to become a specialist. But I failed. I did not complete my study because of the certain factor, which is I quit from my postgraduate study. During that time, during my undergraduate study, I performed alhamdulillah very good, and I work, and then I sorry to share this one, it's quite this one, but I think it's related. That means and then I pursue my study in doing a specialist, and I'm unable to finish my study. And what happened is that I have difficulty to get back into the service, and then I need to pay back all the scholarship, almost that means quite a lot of money I need to repay back to the sponsor. That time I feel my why I become like this, and why I feel very lost. This is my personal experience. Okay, that means I feel like why I want to help people. I want to be a doctor. I want to help people. But why Allah test me like this? Sometimes I feel like that. That one, I'm telling you, faith is number one. Faith. This is very difficult because the Al-Quran said everybody must be tested. And alhamdulillah, I able to it's quite difficult for me to forget the past. But after that, I able to work back, and then I'm doing postgraduate study in other field of study, and I feel more, resilience, daya tahan is more better. And then there's difficulty that time. Yes, because Allah Subhanahu Wa Taala want you to be somebody, more great people. That means he want you to be something. It's not just he just test you for no use, sister. So take it as a test. Everybody tested. You cannot escape from this. This is your test. Okay, sister. I hope answering your question, Sister Shahida.
Okay, Alhamdulillah, we have come to the end of the Q&A session. So we have come to the end of our event. It has been a great day and a wonderful morning with all of you and with Dr. Zuhdi. Thank you, Dr. Zuhdi, for giving us an amazing and insightful talk. And thank you to everyone who came today. I'm sure we all learned a great deal. And a final reminder to all our participants, please fill in the attendance form as well as the feedback form. And with that, I end this talk with Assalamualaikum warahmatullahi wabarakatuh.
Assalamualaikum.